can't say that I've ever had fear. I just have determination, and a lot of it.
You ready, Eddie?
Yes, I was scared. I don't see how a person could not be. Mostly I was scared for my children. I couldn't swallow the idea that they would be raised without a father.
It really was a shock to me to get it.
I mean, shock is not even a big enough word.
Our ultimate goal in treating patients with brain tumors is to find a treatment which eradicates the brain tumor, a cure. Currently, we do not have a treatment which we would call a cure.
Morning. How you doing?
Good. So our efforts are to maximize the patient's survival while maintaining the maximum quality of life.
So you're back to doing everything you want to do?
Yep, full time.
Full time, great.
JC was diagnosed with his brain tumor when Temodar was still being investigated. JC took Temodar for 4 months as part of the clinical trial. He remains cancer-free now after 2 years.
The response to any chemotherapy drug in any type of cancer is variable. The fact that with chemotherapy agents like Temodar, some patients have great responses that are several years in duration, if not more, gives us hope that there are more patients who will respond like that.
You know, you start to read all that stuff about, chemotherapy is just poison and it's going to do more harm than good. But for us, it was absolutely worth it, without a doubt. Absolutely, completely worth it.
The studies indicate that nearly half of the patients who have anaplastic astrocytoma had some form of response. Either the tumor shrank or the tumor stopped growing. That certainly is reason for optimism and hope.
Chemotherapy has a bad reputation, but for the vast majority of patients, Temodar is not like those other chemotherapies.
What about when you took the Temodar last time?
No, it was, no problems. Really. No problems whatsoever.
The whole point of Temodar is so they can have a normal quality of life. We don't want their lives to change just because they have this diagnosis.
We started Temodar
13 or 14 months ago.
Right.
Patients certainly would prefer not having to take any treatment, but of the treatments that are currently available for the treatment of recurrent brain tumors, it is extremely well tolerated and really fits into most people's lifestyle and enables them to continue to do that which they were doing.
So you're doing all right?
Yes, we're doing very well, as far as I can tell. What do you think?
Well, I think you're doing very well. So we're about to embark on our 14th cycle of Temodar.
Temodar lets you lead your life just like every day. It's normal. Nothing changes, except you're taking a pill before you go to bed at night.
Thank you.
This is the scan on Janice. This is from August of this year, and this is from this past week. You can definitely see an area that's abnormal. And here is that same area from this week. We see that we've in fact destroyed quite a bit of the tumor.
I saw your scan. Your scan looks good.
I was thrilled when I was given the word that I would have it done with pills.
Janice has been on Temodar for 3 months.
I think the Temodar pills have just really
Anything else? No.
been great. I really do.
Janice is walking with a very dramatic improvement in her functional status. She is quite focused on getting better and is probably, if anything, impatient.
Day by day, I take it one day at a time. And so far, with the chemo pills, I have gotten mobility, and I feel that I am on the road to recovery.
Having cancer makes you realize what's really important. And you don't realize what you take for granted. And family and friends. I'm married to a wonderful woman, and I'm so fortunate with everything in my life, and I couldn't have asked for a better ending.